Namaste. I'm Dr. Pushpendranath Ranjan. I'm a senior neurologist at the Indraprastha Apollo Hospital and a stroke specialist. I'm here to tell you what you need to know about a cerebral stroke. What is a cerebral stroke? How do you prevent it? And how do you treat it? A brain stroke is a catastrophic event where you get sudden onset or weakness of one half of the body. Please remember FAST, fast. If you find somebody in your family or close by, your neighbor develops symptoms of stroke, which would mean that his face deviates to one side, his arm drifts, he's got difficulty in speaking, he has got a stroke, and you need to go to a hospital for treatment. Broadly, strokes are of two types. One, the ischemic strokes. Two are hemorrhagic stroke. An ischemic stroke is one where there is a clot which gets formed in the brain and occludes an artery in the brain, so that that area of the brain does not get blood supply. And this is called ischemia of the brain. I always like comparing it to a myocardial infarction. This is cerebral infarction. Myocardium, heart gets less blood. Here, brain gets less blood. The second common cause of stroke is a hemorrhage in the brain. Hemorrhage means that because of persistent rise in blood pressure, which you have not controlled, the artery bursts in the brain and there is a collection of blood. So, the symptoms of stroke, whether it is ischemia, whether it is hemorrhage, more or less remain the same. So, remember FAST, fast. If you have symptoms of stroke, you need to immediately go to a hospital which is a stroke prepared hospital. And I must tell you that the Indraprastha Apollo Hospitals, Delhi, is a stroke ready hospital where we have all facilities to treat you. Why should you come early for stroke treatment? What is this so-called golden period which you would hear the doctors talking about? And you also, I'm sure, must have become wiser in the last 1 week, where you've been listening from our department a number of programs about stroke. This golden period is the period where you should reach the hospital. And if you come to us within 4.5 hours of the stroke, we have a drug which is called TPA, which is a clot busting agent. And if you use this drug, 30 to 40% of patients would recover, do very well. But please understand, and please keep it in mind, even if you cross 3.5 or 4.5 hours, still go to a stroke prepared hospital, because we can now treat you even up to 6 hours and up to 9 hours. So what a good news we have for you, that stroke is treatable. And I would also like to stress that 90% of the strokes are preventable. So please don't be 1 in 4 to get a stroke. How do you prevent a stroke? You have risk factors, the modifiable risk factors, the non-modifiable risk factors. We can help you with the modifiable risk factors. Of course, I can't do anything with the genetics. I can't do anything with your sex. But I certainly can adequately treat diabetes, hypertension, cholesterol, sedentary lifestyle, oral contraceptives in women, and of course, if you have had a mini stroke or a TIA. So these are broadly the risk factors of stroke, which you need to look after. So you could have prevention, which is called primary prevention, primarily prevent stroke, and a secondary prevention. What I mean by a secondary prevention is that if you have had a stroke or a mini stroke, you require prevention for the rest of your life. So friends, ladies and gentlemen, again I repeat, stroke is a very complex disease. But 90% of the strokes are preventable. And a large chunk of them are treatable. So please prevent stroke, and God forbid you have a stroke. Please go to a stroke-ready hospital. Please come to us anytime in the night, any time of the day, 24/7, to get you the stroke services. Just a word about COVID. Please don't worry about COVID. COVID is there. It will remain. Take all precautions. And there is an association with COVID and stroke. Our hospital, we have absolutely isolated areas for stroke with COVID, stroke without COVID. So you don't have to worry about that also. We are there to look after you. Please prevent a stroke. Please don't be 1 in 4. Thank you very much. Namaste.